How many days after ovulation can you get pregnant? In this episode, we're talking about this question as well as a few details surrounding this. I'm Dr. Perkins. I'm a board certified OBGYN and welcome to my channel. By the end of this video, we will review ovulation, learn how long egg and sperm can survive, and answer the question as to how long after ovulation can you get pregnant. So let's start by talking about ovulation. Timing is everything. If we ovulate and our egg dies, then no pregnancy can occur. So how do we know when we're ovulating? Well, in general, ovulation occurs 14 days before the next menstrual cycle begins. It's very important that you know all the details about your menstrual cycle as possible to know exactly when this ovulation date occurs. For instance, your menstrual cycle starts from the very first day of a period until the next first day of your period. You count the days in between, and that gives you the total length of your menstrual cycle. With that, a normal length is anywhere between 21 days and 35 days. On average, I would say about 28 to 30 days is normal. Once you have that length completely figured out, you can anticipate when the next menstrual cycle will begin. Then you want to count back 14 days, and that is exactly when you should ovulate. Now, if you have an irregular menstrual cycle pattern, then it's very hard for you to tell exactly when you will ovulate. But if you're very regular, if you know those dates and the lengths perfectly, then knowing when you ovulate and knowing when exactly to have sex will be very clear for you. 14 days before your cycle, ovulation occurs. Your ovulation window starts 4 days prior to that. During that window, sperm can live and survive in your reproductive system and can be ready and available whenever you ovulate. That time frame goes 24 hours beyond the day that you ovulate. Why is that? Well, eggs survive for approximately 18 to 24 hours. Because of that, again, timing is everything. Sperm needs to be ready and prepared to be there and fertilize the egg. An important fact to know is that females are born with all the eggs that they'll ever have for their lifetime. In fact, at the point of conception, there are millions of eggs within a female's body. At the point of birth, there are approximately 2 million eggs left. At the point of puberty, there are approximately 400,000 eggs. In a female's reproductive lifetime, which really lasts about 30 to 40 years, she may then ovulate about 400 or 450 times. So a lot of these eggs are lost, and they're lost every day. Fertility goes down every day. And with this, it's important to know that as you're nearing the end of your reproductive years, that the quality of your eggs and the amount of your eggs has decreased significantly. Now, sperm actually moves very fast. So if you have sex on the day that you ovulate or the very minute that you ovulate, you can actually be assured that sperm can get there in time. Sperm has been shown to move as fast as 28 miles per hour. A tiny little sperm can travel that fast. That is the reason behind why after ejaculation, sperm can actually get all the way through the female reproductive system and make its way to the fallopian tube in 5 minutes. It's pretty fast. It's pretty impressive. Now, that is all based on the fact that sperm is normal and that is functioning well. Evaluation of this is necessary if you're having any concerns about infertility. Oftentimes, infertility tends to be thought of as a female's issue. In actuality, it is equally a female's issue as it is a male's issue. So if you have questions or concerns, we recommend a semen analysis to evaluate your partner's sperm or your sperm to be sure that motility is up to par. If you've been enjoying our conversation so far, please like and subscribe to this channel. Since we're talking about sperm and how fast a sperm can move, it's important for us to talk about motility and knowing whether or not your sperm or your partner's sperm is being efficient. There are things that can affect sperm's motility. Firstly, there may be a genetic cause. This could be due to a congenital problem, or it could be due to a medical problem. There's also an area that is pretty gray where we really don't have an answer to what genetics or how genetics are influencing the movement and motility of sperm. Secondly, there may be an underlying undiagnosed medical problem. Males tend not to get medical care as often as females. This has been shown. Research has proven this. Because of that, some males do have underlying medical problems that is affecting the quality and the amount of sperm production. This is unknown unless testing is done and a diagnosis is made. If you are concerned about possibly having an issue with your sperm or your partner's sperm, it is a good idea to be seen and have a full body evaluation and testing done to be sure that there are not underlying medical problems that has not been diagnosed. Alcohol and smoking has been shown to slow down sperm motility. If there is excessive use, I recommend decreasing that, if not eliminating it altogether. If a male has ever experienced trauma, especially physical trauma, this may also affect sperm motility and, in fact, sperm production as well. Trauma in your childhood, an accident, anything that falls in that category can affect the work and function of the testicles and the production of sperm. Some people may also have a varicocele, which is swelling within the testicles, and this can prevent the body from creating and producing adequate quality sperm. There are other things that may affect sperm health. These things I absolutely recommend if you are a male or for your male partner. Number one, I recommend that you avoid excessive exposure to mobile phones. With this, there is radiation that is being released from mobile phones, and if you have this phone really close to your genitals and to your testicles, they may negatively affect the production and quality of sperm being produced. Number two, if you are overweight, this has been shown to decrease production of sperm and the quality of sperm. If the quality of sperm goes down or the production goes down, then not enough sperm might be available, and quality sperm might not be available to make it all the way through the reproductive system. Number three, avoid overheating the testicles. What does that mean? I know you're not frying testicles. That's not what I mean. But overexposure to heat will decrease the function of sperm and the production of sperm as well. There is a reason why sperm is in a scrotum or in a sac hanging outside of the body. Sperm needs to be cooler than what our normal body temperatures are. Because of that, biologically, they're located where they are. Now, if you tend to participate in activities like hot yoga or use the sauna for a very long time, anything that creates an environment of a lot of heat, then sperm and testicles may not function well. This is also linked to having temperatures like a fever for an extensive period of time. When your internal system is also overheated, this may affect your testicles and the ability to produce good sperm. Number four, avoid infections if possible. If you have a history of sexually transmitted infections, sometimes there could be damage to your testicles and your ability to produce good sperm. Number five, I recommend that you avoid soy products. The reason is soy products tend to have chemicals that are very similar to estrogens that are formed and are made in a female's body. A male's body should not have a high level of estrogens. This is essentially counterproductive and counterintuitive. So it's best to stay away from estrogen type foods, and soy is high on that list. Number six, know that sperm decreases after the age of 35. Oftentimes we talk about the age of 35 for females because we know that this is a time frame where you become high risk and the quality of your eggs are low. Similarly, in a male's system, sperm production decreases. The good thing is that it does not stop. Males can continue to produce sperm for a very long time, possibly until death. With these tips, you have the best chance of creating sperm that are functioning well and well equipped to make it through a female's reproductive system. I hope you've enjoyed what we've talked about today. As a free gift to you, at the link in the description, I have a free copy of my ebook, Hormones Don't Lie. Thank you for being here, and I look forward to seeing you on the next episode.